MedWatch 7 is sponsored by Memorial Health System of Southwest Oklahoma.
Your brain needs just as much care as your body. That's why Memorial Health's Behavioral Health Center strives to help people struggling with their mental health in our community and beyond.
We serve patients who have mental health issues from age 4 to age 75.
Almost all ages are welcome to receive mental health care at Memorial Health's Behavioral Health Center.
The goal is with children and adolescents in particular, it's to optimize their functioning, get them back out, back into their lives, into their family, in a way that they can be successful.
It offers both outpatient care and inpatient care to people across our communities and Oklahoma as a whole.
We are a tertiary referral center for statewide. We have patients, I've had patients from Miami, from Guyman, from all over the state, lots of patients from Tulsa, lots of patients from Oklahoma City.
The center is split into 3 units, child, adolescent, and adult, so healthcare professionals can better treat their patients' different needs. The Behavioral Health Center treats patients with varying mental health challenges and crises. Outpatient care is meant for those who can manage their mental health at home, while inpatient care can be helpful for people who need around-the-clock care. If you're considering inpatient care, there are some steps you'll need to take before being admitted.
We have an assessment process. You don't necessarily have to have a referral, but if a child's exhibiting self-harmful or suicidal behaviors or significant aggression, people could call here and get an assessment, a mental health assessment, and we can make a determination about whether this is the appropriate level of care or some kind of outpatient treatment is more appropriate.
But how do you know it's time for inpatient care?
In the child unit, we deal with kids who have significant aggression or issues with profound oppositional behaviors, but it has to be something that's dangerous. I mean, they have to be doing things that are aggressive to the point of being dangerous or self-harmful or suicidal.
That goes for other units as well. As for the amount of time people receiving care typically stay,
our average length of stay on the child unit is about 30 days. Our average length of stay on the adolescent unit is 14 to 30 days. The adult unit has about a 7-day length of stay.
Keep in mind, patients may stay for a longer period of time depending on the severity of their mental health challenges.
We can keep kids as long as they need to be here. Sometimes we will have kids here. We've had kids here for as long as 4 to 6 months. If they have, a lot of times when we have children who are in DHS custody and placement is a real difficult issue for those kids and they have significant trauma or behavioral health issues, those kids can sometimes stay quite a bit longer.
Once a patient is ready, they'll transition to outpatient care with a nurse practitioner and be connected with therapy services, which Memorial Health offers. And if you're experiencing a mental health crisis, call or text 988 to reach the Suicide and Crisis Lifeline. You don't have to go through this alone. For MedWatch 7, I'm Skylar Teddington.